Alright guys, we have a patient with paraproctitis, hereditary gingival fibromatosis, and prostatitis. What do you think is the diagnosis?
I believe it's most likely pipe-colic acidemia due to the presence of hereditary gingival fibromatosis.
I agree with Leslie. The symptoms suggest a case of pipe-colic acidemia.
You know what? I also think it might be pepcolic acidemia. The combination of paraproctitis and prostatitis supports my theory.
You're all wrong. It's not pipe-colic acidemia, but rather a rare condition known as pipe-colic acidemia. We need to perform vitrectomy on the patient despite it being risky for their life. Alright, boss. What's up?
Hawks, I've just got to ask you about your decision to perform a vitrectomy on your patient with pipe-colic acidemia.
Well, Tracy, I have my reasons for this.
Really? And those reasons are?
During a deep therapy session with Dr. Hugh, we came to the conclusion that should I have a patient with pipe-colic acidemia in the future, vitrectomy would be the right solution.
I appreciate that you take your therapy session seriously, but Dr. Hugh's not qualified to make those calls.
He didn't make the call. He helped me through a flashback in the future that led me to believe it was the right call.
What even happened in this flash forward?
I found my way into some bitch named Tracy's office where she asked me this stupid question, then got trapped in a loop until I came up with the right answer.
Welcome to the loop, Hawks. Let's try again, shall we?
We need to reevaluate our approach with this patient, Hannah. The vitrectomy was not the right treatment for pipe-colic acidemia. We should have considered other options.
I know it's not ideal, Randall, but Dr. Hawks seems so confident in his decision. I think we can't just abandon the vitrectomy entirely. Maybe we need to find a way to make it work with pipe-colic acidemia instead.
We can't just make it work, Hannah. We have to be responsible and consider the patient's well-being above all else. The vitrectomy was not meant for this condition, period.
Maybe you can't just make it works.
Maybe shut up?
You all are incompetent. Your misdiagnosis nearly cost a life.
Dr. Hawks, we apologize for our mistake. We'll review and correct our approach to avoid such incidents in future.
We understand the gravity of our error, Dr. Hawks. We assure you it won't happen again.
We're sorry about the patient's unfortunate outcome due to our misdiagnosis, Dr. Hawks. Let's learn from this mistake and improve our skills.
That doesn't excuse your gross negligence. I'm disappointed in all of you.
Maybe you're starting to see signs that Dr. Hugh isn't a great excuse for your stupid ideas.
Don't you dare shame him for trying. I was stuck on this case for what felt like months in that session.
Yeah, he gets a bit hypnotic sometimes. Very weird guy.
How do you know him?
He's an old friend of mine. I met him through Gary several months back.
You mean Randall?
No. I was talking about that one doctor you had that peddled drugs from the pharmacy.
Hannah, there never was a Dr. Gary.
That's right, Randall. Let's drop the conversation.
While you decide on Schrodinger's Gary, I'm getting lunch. Johnson, did I have a doctor named Gary at some point in time?
Isn't that Randall's first name?
I thought it was, but I later learned it was James.
I don't think I remember a Gary.
Something is very weird in this hospital. Frank brought up a Gary when he threw that tantrum a few weeks ago, and now Hannah has mentioned him as well. And both times Leslie and Randall had strange reactions to that name being dropped.
I seriously don't know. I feel like everything before we reunited a few months ago is a blur.
I do as well. There are lots of things going weird in my head, and I need to find this Gary person.
Best of luck. If you need any help, let me know. By the way, how's that patient of yours doing?
You think I'm wrong? Well, you're all wrong. This pipe-colic acidemia was a mistake from the start.
And just how did you come to this conclusion, Hawks?
This is not the time or place for these kind of theories.
Hawks, please explain yourself.
All right. I discovered that during lunch with Dr. Johnson, we had a breakthrough moment and realized that pipe-colic acidemia was not accurate.
And what does this mean for our patient?
I'm sure they'll be thrilled to hear you solve this while eating your lunch.
Our patient has Lhermitte-Duclos disease, which is a much rarer and scarier diagnosis. But don't worry, it's nothing we can't handle.
And what's the prognosis?
The prognosis for Lhermitte-Duclos disease is not great. Let's put it that way. But like I said, this team's got a solution for everything. Well, time to go home, boss. All's well that ends well.
Did you find the right diagnosis?
Yeah, turns out I mixed my notes up on another patient with a similar condition.
Happens to the best of us.
Yep. Have a good night, Tracy.